Tobacco is the leading cause of preventable illness and premature death. What does tobacco do to your body and brain? How does it affect your health? Hello everyone, this is Dr. Air, quadruple board certified psychiatrist, addiction specialist, and lifestyle medicine physician. We all know tobacco kills. We know tobacco causes lung cancer and heart disease, but do we know the other effects? Do we know what other body organs tobacco affects? Do we know the various disease conditions caused by smoking cigarettes? Well, let's talk about that a little bit. The human body has several systems. Unfortunately, tobacco can affect virtually all the systems in your body. This shouldn't come as a surprise, considering that cigarette smoke contains over 4,000 components. Nicotine from cigarette smoke reaches the brain in 7 to 10 seconds. In the brain, nicotine attaches to portions of the brain known as receptors, specifically the acetylcholine receptors. This process causes the release of large amounts of a chemical called dopamine. In addition, there is also what we call downregulation of the acetylcholine receptors. These events alter the brain chemistry and lead to addiction as well as cravings and withdrawals when you try to quit cigarettes. Cigarette smoking has also been associated with dementia, a condition that eventually leads to memory loss. Smoking increases your heart rate and blood pressure. It also increases your risk of heart disease and sudden death. This is because smoking can lead to an increase in your blood pressure and also causes thickening of your blood vessels, a condition known as atherosclerosis. Smoking also causes narrowing of your blood vessels and also makes your blood thicker. It can make your heart develop irregular beats as well. Strokes are also more common in people who smoke. Cigarette smoke is the leading cause of COPD, chronic obstructive pulmonary disease, a condition that makes breathing difficult. It can also cause other lung conditions like pulmonary hypertension and pneumothorax. Smoking is associated with various types of cancers that affect the mouth, larynx, esophagus, stomach, lung, bladder, kidney, pancreas, and cervix. In fact, studies show that 30% of all cancer deaths are related to cigarette smoking, and the risk of cancer death is 2 times higher in smokers and 4 times higher in heavy smokers. Smoking also causes stomach ulcers and can worsen your acid reflux for those who have GERD, gastroesophageal reflux disease. It has also been shown to increase the risk of Crohn's disease. Tobacco use is a risk factor for kidney disease, deep vein thrombosis, hyperthyroidism, and hypothyroidism. It is also associated with diabetes. In men, smoking can ruin your sex life. It is one of the leading causes of erectile dysfunction, and it also decreases sperm number and function. In women, cigarette smoking is associated with low estrogen levels, early menopause, decreased likelihood of getting pregnant with the possibility of miscarriages. Smoking can also lead to osteoporosis and fractures. Tobacco use during pregnancy causes low birth weight, possible birth defects, and even death of the baby. Doctors usually advise you to quit smoking a few months prior to having surgery. The reason for this is that smoking can lead to complications after surgery such as pneumonia, lung collapse, and poor wound healing. Now, I don't say all of this to scare you, but rather to let you realize that some of the medical issues you currently have may be due to smoking, and you could be in a much better physical and mental health if you start. The beauty of quitting cigarettes is that you can heal your body after you stop. Studies show that after 10 to 15 years living smoke-free, the risk of dying from smoking returns nearly to that of people who never smoked. There are a ton of helpful quit smoking programs and resources out there, and I'll leave some links below. Subscribe to this channel for more tips on smoking cessation. Speak to you soon.